Medical Assistant Practice Test for Clinical Competency 2023 50 questions with explained answers. Sterilizations means that A. All organisms have been removed from an object. B. All pathogenic organisms have been removed. C. Debris has been removed with soap and water. All organisms have been removed from an object. Which of the following actions should the MA take to ensure disposable thermometers are ready for an exam? A. Make sure they have been autoclaved within the past 28 days. B. Ensure the expiration dates have not passed. C. Swab tips with alcohol. Ensure the expiration dates have not passed. What info will not be found in the medical record of the PT? A. If the patient admits to any illegal drug use. B. Personal opinion of office staff. C. Legal history of the patient. Personal opinion of the office staff. Using a tape measure to evaluate the head and chest circumference of an infant is called A. Auscultation. B. Mensuration. C. Palpation. Mensuration. What is the max time allotted for a collected blood sample to sit in a serum separator tube before being centrifuged? A. 1 minute. B. 5. C. 15. D. 30 minutes. AMA is giving a DPT injection to a 6mo. The assistant would administer the injection where? A. Upper outer quadrant of gult. B. Deltoid muscle. C. Vastus lateratus. D. Subtissue of thigh. Subtissue of the thigh. If the physician is going to do a pap smear, the MA should have which of the following equipment? A. Curette and dilator. B. Speculum and water-soluble lubrication. C. Suture and removal kit. D. Hemocult tray. Speculum and water-soluble lubrication. Emergency treatment for a second-degree burn would include A. Bandage tightly. B. Breaking any blisters seen. C. Applying clean, cool, wet cloth to the area. D. Scrubbing the site with antiseptic. Applying clean, cool, wet cloth to the area. Evaluation of the spinal column is accomplished easily from which of the following positions? A. Knee chest. B. Prone. C. Supine. D. Lithotomy. E. Trendelenburg. Prone. To respect the patient's privacy while obtaining information about their e-checks, you should A. Ask patient to fill out form rather than ask them in an interview. B. Ask PT to specify people who can give information about her. C. Take the PT to a quiet and private area. D. Let the doctor ask them the questions. Take the PT to a quiet and private area. Which term is defined as the concentration at which a substance in the blood, not normally excreted by the kidneys, begins to appear in the urine? A. Surnotin. B. Refractive index. C. Renal threshold. D. Micturition. Renal threshold. The PT is having occult blood in the stool caused by a medication that they are taking. Which medication would you suspect? A. Lisinopril. B. Coumadin. C. Prozac. D. Ativan. Coumadin. A fomite is an animal or insect that can transmit disease. B. A method of removing pathogens. C. An inanimate object that can harbor pathogens. D. A sexually transmitted disease. An inanimate object that can harbor pathogens. To correctly treat an adult with a foreign body airway obstruction, the MA should first A. Open PT's mouth and remove any foreign body that is seen. B. Lower PT to the floor and start to perform abdominal thrusts. C. With the left hand check the pulse at the left carotid artery. D. Ask the PT as he can speak. Open PT's mouth and remove any foreign body that is seen. The Ishihara test is used to diagnose A. Myopia. B. Hyperopia. C. Presbyopia. D. Color blindness. Color blindness. A non-sterile item is accidentally added to a sterile field being prepared for the suture of a skin lac. Once the MA discovers this, they should A. Report it to the physician. B. Remove it at once. C. Leave it on the field but cover it with a sterile towel. E. Redo the sterile field and resterilize any instruments. Redo the sterile field and resterilize any instruments. The process used to wash and remove tissue from medical instruments is called I. Asepsis. B. Disinfection. C. Sanitization. D. Sterilization. E. Boiling. Sanitization. Which of the following is the max amount of time a tourniquet should remain on a PT's arm during a routine venipuncture? A. 30 sec. B. 60 sec. C. 2 minute. D. 3 minute. E. 5 minute. 60 sec. In a large-scale national disaster or disease outbreak, which considerations should be taken? A. Some PTS will come to the office for care due to the overcrowded or B. The practice may need to administer vaccinations or immunizations to PTS. C. Open lines of communication with local public health officials and participation in coordination plan. D. None of the above. All of the above. All of the above. Employment, use of tobacco and alcohol, and exercise habits are listed where in the PT chart? A. Social HX. B. Chief complaint. C. Review of systems. D. Medical HX. Social HX. If your PT is being treated for a severe upper respiratory infection, which meds would you not expect to see ordered? A. Amoxicillin. B. Albuterol. C. Robitussin. D. Hydrochlorothiazide. The microscope condenser is responsible for A. Collecting and concentrating light rays. B. Holding and moving the slide. C. Controlling the amount of light focused on an object. D. Coarse and fine adjustment for object focus. Collecting and concentrating light rays. You should suspect that a PT might possibly be having a heart attack if she is complaining of A. Blurred or double vision. B. Severe headache. C. Pain in the shoulder or jaw. D. Difficulty understanding spoken words. Pain in the shoulder or jaw. When drawing multiple tubes of blood via venipuncture, what is the correct order based on the colored tube stopper? A. Lavender, red, green, yellow. B. Red, yellow, lavender, green. C. Green, yellow, lavender, red. D. Gray, yellow, red, blue. E. Yellow, red, lavender, green. Yellow, red, lavender, green. Which of the following is a CLI wave low complexity test? A. Microscopic examination of urine. B. Gram stain. C. Blood chemistry. D. Pregnancy test. Pregnancy test. Normal respiratory rate for an adult is A. 8 to 12 BPM. B. 8 to 16 BPM. C. 12 to 20 BPM. D. 12 to 26 BPM. E. 20 to 26 BPM. 12 to 20 BPM. After drying and removing packs from the autoclave, the first thing you should do is A. Place newly sterilized packs under the older ones. B. Discard all outdated packs. C. Check the indicators to make sure it has changed colors. D. Mark packs with your initials and the date sterilized. Check the indicators to make sure it has changed colors. Which of the following medications would not be ordered for an elderly PT with cardiovascular disease? A. Lanoxin. B. Lasix. C. Potassium chloride. D. Lisinopril. Prozac. To be prepared for an office emergency, you should I. Keep policies for emergencies nearby for reference. B. Ask more experienced person to handle it. C. Review policies and be aware of location of emergency supplies. D. Call 911. E. Make a list of emergency phone number and place it near the phone. Review policies and be aware of location of emergency supplies. Examples of a bandage include A. Steri-strips. B. Telfa. C. Tubular gauze. D. 4x4 gauze. E. Clear of sight, tubular gauze. Which test is used to determine the best antibiotic to treat a condition? A. Blood agar. B. Culturing. C. Morphology. D. Liquid culture medium. E. Sensitivity. A blind weight is done on a PT by A. Not writing the weight in the PTS chart. B. Asking the PT to weigh at home and report it when he comes in. C. Weighing the PT in the wheelchair and subtracting the weight of the wheelchair. D. Shielding the readout so the PT is unaware of the result. E. Shielding the readout so the PT is unaware of the result. An effective way to handle PT emergencies in a medical practice office is to take what steps in advance? A. Ask very sick PTS to go to the B. Identify the at-risk situations that are most likely to occur, given the PT population, and prepare to provide care for these situations. C. Make sure that a doctor is constantly available. D. Have a first aid kit. Identify the at-risk situations that are most likely to occur, given the PT population, and prepare to provide care for these situations. In the event of a large-scale bioterrorism, what steps would not be an approach to be used by a medical office practice? I. Coordination with local public health officials. B. Providing vaccines. C. Knowing S&S related to the disease outbreak. D. Sending PT tour for diagnosis. Sending PT tour for diagnosis. Snellen testing results give information about I. Blood sugar results. B. Visual acuity. C. Ability to hear vibratory sound. D. Blood pressure. Visual acuity. Which emergency situation should receive first priority? A. Bleeding from a lac on the arm. B. Occluded airway. C. Open fracture of a femur. D. Mid-sternal chest pain, occluded airway. The MAS role in obtaining informed consent is I. Explaining risks and benefits of the procedure. B. Making sure PT understands and has no questions. C. Answering all the questions that the PT has. D. Witnessing the signature of the PT. Making sure PT understands and has no questions. To remove sutures, the MA should have a tray of instruments including A. Kelly hemostat. B. Neo scissors. C. Sen retractor. D. Litar sixers. Litar sixers. When there is an unidentified clear liquid on the floor of the exam room, after a PT leaves the room, the MA should go ask the PT if they are aware of what the liquid is. B. Clean up the spill with a disposable paper towel and place in bio bag. C. Put up wet floor sign and call housekeeping. D. Put on disposable gloves. Clean up the spill with disposable paper towel. Place in bio bag. Put on disposable gloves. Clean up the spill with disposable paper towel. Place in bio bag. A viral infection. A. Cannot be transmitted by droplets. B. Will always resolve in 7 to 10 days. C. Does not respond to antibiotic treatment. D. Causes tuberculosis. Does not respond to antibiotic treatment. Factors that affect the action of drugs include all except A. Body weight. B. Use of generic medication. C. Sex. D. Age. Use of generic medication. When checking supplies in the office, the MA notices an instrument in the cupboard was autoclaved 28 days ago. They should A. Check for damages. B. Count to see if there is enough for expected procedures. C. Place packages back in the autoclave and run. D. Unwrap, repack, and run autoclave. E. Redate the packages within additional 28 days. Unwrap, repack, and run autoclave. Symptoms of insulin shock include A. Fruity or acetone smell to breath and a decreased blood sugar. B. Tremulousness and an elevated blood sugar. C. Diaphoresis and a fruity smell to the breath with elevated blood sugar. D. Confusion, tachycardia, and an elevated blood sugar. E. Diaphoresis, tremulousness, confusion and decreased blood sugar. Diaphoresis, tremulousness, confusion and decreased blood sugar. Which of the following steps helps ensure smooth operation in the office during a PT emergency? I. Adhering to a pre-established plan and protocols. B. Avoid setting apps for seriously ill PTs. C. Range for close proximity to the localer. D. Clear office during PT emergency. A. Have an AED. Adhering to a pre-established plan and protocols. Prior to administration of local anesthesia, the MA should I. Administer a test dose to test for allergies. B. Ask PT if they have had it before and use the same medication. C. Carefully take an allergy checks from PT. D. Make sure PT has a post-procedure driver. E. Look in the chart so see if PT has previous surgical checks. Carefully take an allergy checks from PT. The knee chest position is used for A. Proctological exams. B. Vaginal exams. C. Exam of the chest and upper torso. D. PT who have difficulty breathing. E. Treatment of hypotension. Proctological exams. Which position should the PT be in for a vaginal exam? A. Prone. B. Lithotomy. C. Sims. D. Fowler's. Lithotomy. The first thing an MA should do when they come across an adult who is not breathing is A. Give to rescue breaths. B. Roll the PT to the left. C. Check for carotid pulse. D. Look into the mouth for an airway obstruction. Check the carotid pulse. When checking the sterile supplies, the MA should A. Unwrap and resterilize packages older than 21 days. B. Examine packs and discard any that are damaged. C. Range packs by expiration date. D. Seal expired packs in plastic to extend their life. Examine packs and discard any that are damaged. Sterile technique must be used when A. Placing sutures in a new lac. B. Removing sutures from a healed lac. C. Performing an IFOB. D. Performing a pap smear. E. Placing sutures in a new lac. Which measurement is a normal specific gravity of urine? A. 1.00. B. 1.025. C. 1.050. D. 1.125. 1.025. What is a disposable glass or plastic tube used for hematocrit determination? A. Microcollection tube. B. Capillary tube. C. Reagent tube. D. Serum separator tube. Capillary tube. Which medication would most likely not be ordered for a 50-Y postmenopausal woman? A. Premarin. B. Provera. C. Verisip. D. Calcium citrate. E. Multivit. Verisip. The ratio for making a disinfectant fro bleach and water is A. 1:5. B. 1:10. C. 1:20. D. 10:1. E. 1:100. 1:10. To screen for hearing acuity or bone conduction of sound, the medical assistant would use A. Otoscope. B. Ophthalmoscope. C. Tuning fork. D. Snellen test. Reflex hammer. Tuning fork. What is not considered proper PT instruction for obtaining clean catch midstream urine sample? A. Have PT remove undergarments. B. Make sure not to touch the inside of the container. C. Continue to hold labial part and void a small amount into the toilet. D. Wipe back to front. Wipe back to front. If AMA discovers a known diabetic PT who is disoriented and confused, the first thing they should do is A. Check vitals. B. Administer glucose. C. Check sugars. D. Check for spontaneous respiration. Administer glucose. A procedure that AMA would not expect to take part in when doing minor surgeries in the office is A. Suture of lacs. B. Biopsy of lungs. C. Cyst removal. D. Biopsy of skin lesion. E. IND of wound. Biopsy of lungs. Heart sounds that are heard when the blood pressure is being measured are called the A. Korotkov sounds. B. Rin sounds. C. Snellen. D. Isharher. Korotkov sounds. The popliteal pulse is located A. Thumb side of the wrist. B. Behind the knee. C. Dorsal surface of the foot. D. Apex of the heart, behind the knee. The most important thing to do to prevent the spread of infection is A. Use bio bags. B. Dispose of sharps in ridged container. C. Wash your damn hands. D. Disinfect PT care equipment between uses. Wash your damn hands. Which type of urine specimen contains the greatest concentration of dissolved substances? A. Random. B. First voided morning. C. Clean catch midstream. D. 24-hour. First voided morning. When moving a heavy object, one should A. Bend from waist. B. Ask for help after attempting it yourself. C. Keep object 5 inches from body. D. Assess object prior to attempt. Ask for help if needed. Assess object prior to attempt. Ask for help if need. When removing paper soiled with biohazardous material from the exam table, the MA should do what? First, A. Use sterile gloves. B. Roll paper inward. C. Gather soiled paper in gloved hands and discard. D. Roll inward away from the body. Roll inward away from the body. In an infant, you should check the pulse in which of the following arteries in an emergency situation? A. Carotid. B. Radial. C. Brachial. D. femoral. E. Temporal, brachial. The generic name for Lipitor is A. Atenolol. B. Atorvastatin. C. Clopidogrel bisulfate. D. Furosemide. Amlodipine, atorvastatin. After a PT has had a grand mal seizure, one would expect the PT to be A. Confused and drowsy. B. Excited and hyperactive. C. Hypotensive with decreased pulse. D. In need of airway management. E. Needing immediate transport to her. Confused and drowsy. The most appropriate position for a PT with respiratory problem is A. Trendelenburg. B. Fowler's. C. Lithotomy. D. Dorsal recumbent. Prone. Fowler's. Which is not a normal vein for phlebotomy. A. Cubital. B. Brachial. C. Hepatic. D. Cephalic. E. Basilic. Hepatic. Which of the following situations would be the least concerned when involved in a sterile procedure? A. Talking over the sterile field. B. A member of the sterile team having loose hair. C. A non-sterile person entering the room. D. Adding non-sterile items to the sterile field. E. A tear of the glove. A non-sterile person entering the room. Draping is done primarily for convincing doctor. B. Keeping PT warm. C. PT privacy. D. Convincing MA. PT privacy. To take BP correctly, the MA should A. Use any BP cuff available as long as it fits the arm. B. Have arm at or near level of heart. C. Pump cuff up until unable to hear pulse. D. Release air rapidly to decrease PT discomfort. Have arm at or near level of heart. A person who has difficulty breathing experiences swelling of the respiratory tract following a bee sting may have I. Me. B. Anaphylactic shock. C. COPD. D. Cardiogenic shock. Anaphylactic shock. Which is not true regarding TB skin testing. I. A small amount of TB is administered intradermally. B. Results are read in 48 to 72 hours. C. Induration is a positive indicator of disease. D. Person who has been vaccinated with BCG will test positive. Induration is a positive indicator of disease, which is not a proper procedure for performing the multi-sticks 10 reagent strip test. I. Immediately recap bottle. B. Do not touch strip with your fingers. C. Hold strip in vertical position. D. Completely immerse the strip in specimen. D. Hold strip in vertical position. Major depression is most commonly treated with A. Xanax. B. Ativan. C. Zoloft. D. Buspert. Zoloft. Which of the following instruments would not be needed when prepping for a cyst removal? A. Scalpel. B. Needle holder. C. Send retractor. D. Dressing forceps. E. Speculum. To encourage an elderly person to give info while taking PTHX, the MA should A. Ask yes or no questions. B. Interview family member. C. Speak loudly. D. Inform PT of short time frame. E. Ask open-ended questions. Urine or serum pregnancy tests are utilized to detect the presence of what? A. ADH. B. HGH. C. HAP. D. HCG. The correct position to place the PT who has fainted is A. Prone. B. Trendelenburg. C. Lithotomy. D. Supine. E. Fowler's. Trendelenburg. If AMA is giving a 75-pound child a dose of antibiotics using Clark's law, which dose would be administered when the adult dosage is 500 milligrams? A. 500 milligrams. B. 250 milligrams. C. 200 milligrams. D. 125 milligrams. E. 375 milligrams. 250 milligrams. When performing an EKG on a PT, if the tracing on the paper is not what is expected, the first thing that should be checked is A. Placement of electrodes. B. Status of patient. C. Electrical interference. D. Machine settings. E. PT movement. Status of patient. When performing a surgical hand scrub, make sure to A. Wash of 60 sec. B. Hold fingers lower than wrist. C. Dry hands with paper towel. D. Hold fingers higher than elbows. Hold fingers higher than elbows. Lyme disease, if untreated, can progress into A. Viral infection. B. Contagious disease. C. Chronic infection. D. Acute infection. A. Non-pathogenic condition. Chronic infection. Initial treatment for a sprained ankle would include A. Application of heating pad in 20-minute intervals for first 48 hours. B. Exercise ankle to prevent stiffness. C. Application of ice for 20-minute intervals for first 48 hours. D. Massage ankle with pain relief ointment PRN. E. Application of air cast to lower extremity. Application of ice for 20-minute intervals for first 48 hours. Which of the following reagent strip panels would show an abnormal finding if a person is suffering from a bacterial UTI? A. Glucose. B. ++ nitrates. C. ++ ketones. D. Bilirubin. E. ++ protein, plus nitrates. To palpate the pulse in an adult, the usual procedure would be to I. Listen with stethoscope at apex of heart. B. Feel at inner aspect of thumb side with two fingers. C. Use thumb of dominate hand to feel temple area of the skull. Feel at inner aspect of thumb side with two fingers.